Happy Motivational Monday. Welcome to the first one of 2025. I know, yes, I took some time off, but I have a few questions I want you to reflect on, and I've had time to reflect on them myself. So number one is, do you know your purpose? What is your purpose? Why do you want to be a nurse, or why do you remain a nurse? And when I got to thinking about it, I thought about this. I have a fifth grade journal. Yes, I have a fifth grade journal that is 52 years old. And when I took a look at it, one of the things it said that I wanted to be was a registered nurse. It also said I wanted to be an educator. So, I have the best of both worlds of being a nursing professor, able to be both a nurse and an educator. So I say to you to think within yourself, what actually is your purpose when you think about that question? The second question for you is this. What makes you want to be a nurse if you're a nursing student? Not none of that I care about people, because I get that all the time, but really, what makes you want to be a nurse? Because so frequently we're seeing that nurses get into the profession, they pass the boards, they're in the new grad program, but they're not staying. And something makes me think that they don't really know what they're getting into. And so I encourage you that with all of your clinical assignments, that you take those assignments really seriously and try to get in there to see what it is like to really be a nurse, and ask questions of your preceptor. Do those types of things so that you don't get all the way through the program, you get accepted in one of these hospitals, and then you're like, this is not for me. And last but not least is, what keeps you motivated to go to work every day? Yeah, I know it's a decent income, but it has to be more than that. And so when I asked myself that question, I came up with a list. So let me tell you that. I love seeing change in policy, change in my patients. They come in and they're really distraught and in distress, and they leave out and they got it. They're like, okay, I got to do what's best for me. Income, I can't say it enough, and I don't want that to be your only motivational force, but it does give you a livable wage. And these days that's getting harder and harder to find. It brings with it variety. I can give you a list of jobs that I've had, and I have not been a person who jumped around. I just always had one job, one full-time job, and then I was able to do extra things on the side. Making a difference, really making a difference. I always say this, I love my people. Not that I don't love everybody, but I really love my people. And when I say that, I mean it. I'm not ashamed to say it. I think there are people who really do have healthcare disparity, and it is my goal to help minimize that healthcare disparity among my people. And equally rewarding as it is pay, there wasn't a day that I didn't leave the hospital and really reflect and think that I had done some good. So yes, is it hard? Is it tough? Is it just like, these people ain't listening to me? All of that is true, but two things can be the same at the same time. All right, so hopefully that helps. New nursing students, new grads, give it a try. If you're on the wrong unit, just say that. Hey, this is not working for me. Maybe you need to go to another unit. Maybe you need to go from med-surg to the emergency room. Maybe you need to go from labor and delivery into postpartum. It is a wide open field of things that you can do. So hopefully that helps. If you like this video, thumbs up and subscribe, and I'll see you next video. Bye for now.